everybody. 1 in 4 people are walking around with elevated blood glucose levels and at risk for diabetes. The frightening part, most of them aren't aware of it. There's a convenient way to get tested and start fighting diabetes through your diet. To explain, please welcome HEB pharmacist Gina Eubank. Hello.
Good morning.
Now, I asked people during the commercial break in the audience, how many of you are diabetic or know somebody who's diabetic? All right, just about everybody's hand has gone up. We're at epidemic levels in this country. What is diabetes and what does it do to wreak havoc in the body?
Okay, first off, what's normal is people think sugar is bad. Well, glucose is what your body uses for energy because it breaks down food. So when you're diabetic, you have glucose floating around in your body and then it stimulates your pancreas to release insulin. Okay, and then insulin couples up with your glucose and gets it in the cell, so then you can utilize it. When you have diabetes,
the pancreas is under stress.
Well, it's not producing enough insulin for type 1, and then for type 2, also your pancreas isn't functioning properly, and that can be related to, you know, there's 4 risk factors you can control if you're obese, if you're sedentary, if you eat a white diet that's very high in carbohydrates, the processed kind, where your body just completely metabolizes it into sugar.
Yeah.
Because they think, oh, I don't eat any sugar, but they eat the rice, the pasta, the breads, the things like that.
Yeah, and of course the problem there is that it can lead to blindness, it can lead to, you know, ultimately, organ failure, ultimately lead to death.
Exactly.
So the other things that you're talking about, the fourth one is gestational diabetes. It happens oftentimes during pregnancy, but there are several cases where this can go away. That's the nice thing about, if I can say a nice thing about type 2 diabetes, is that lots of people can get it under control or get rid of it. All right, one way to do it is through diet, as you mentioned, and what we're finding more of now in the stores, and you all do at HEB, are the foods that can help us get there.
Yes, and I'm just thrilled that HEB has developed these products, because a lot of people, when they are diagnosed, they think, well, I'll never be able to eat, you know, bread again or pasta. And HEB, you know, we have a pasta here, and what they've done is they've incorporated more fiber and protein into this, so it's more, it keeps that glycemic index down. Yeah. And so you still have to count
no spikes, it keeps it level.
Exactly. You want to keep it in that zone. And so you still have to count it towards your daily allotment, so you can't, you know, eat a huge.
Right, but what you eat works better with your body.
Yes,
okay,
exactly.
All right. And then, of course, there are things like the milk.
Yes, we have Mutopia over here, which this has, you know, 45% less sugar, it has more protein, it's lactose free, so people, I have many patients that are not even diabetic that will drink this milk, eat the bread, and
because it keeps their body more stable. All right, well, we have one of our audience members who says she's a big milk drinker. You like milk, Janice?
Yes.
All right, well, Janice, you got to taste this here because it's a little different. And tell us what you think about this milk right here, Mutopia.
Real good.
The real good. See, now, and you have diabetes?
Yes.
So you understand how important it is to have to manage that diet and how hard that can be.
Do you feel deprived at all by drinking that?
No, it's good. I think I drink that every day.
Oh, good.
And then have yourself a piece of bread with the peanut butter on it on top of that.
And that's the glycemic bread, so, you know, can you tell a difference in the bread from the regular?
And I love bread.
No, it's
there you go. All right, Gina, let's mention, we talked about the importance of knowing your numbers. So at HEB, oftentimes people can go and get tested there to find their numbers. Also about this, the meter, how they can get a free meter, possibly.
Okay, I love this meter. This meter, first off, is only $9.99. Look how small this meter is. It is tiny. It's teeny tiny, okay? So you can buy, and it just attaches to your strip, so you can throw it in your purse. So somebody that's not sure if they're diabetic, or if they have a friend who's diabetic, they can just go pick this up, mail in the rebate, and get it for free. It's $9.99.
Great.
You know?
Yeah.
And it comes with the strips and a little lancet to get them started. If you know you're diabetic, get your doctor to write a prescription, go to the HEB, and then we can process and give you this one for free. And this is the one that has all the memory in it, so you can go to your doctor and take this meter, and it has your entire history in it.
All right. Well, Gina, thank you very much. And if you have any questions about the food, you can always go to your pharmacist, because that's what you all study, is reaction to things in the body.
Yes.
All right. Our studio audience, by the way, is getting a taste of the new HEB Glycemic Health Bread with a bit of peanut butter. You can monitor your numbers for free and check out HEB's products to help keep your blood sugar levels stable. For more information, log on to heb.com/pharmacy. All right, earlier we discussed how technology can put a man on the moon or in space, but how can it help you stay in shape? which is part of what we talked about here. All right, the high-tech answers when we come back.